Despite its prevalence, endometriosis is often misdiagnosed or not diagnosed at all, leading to delayed treatment and poor outcomes for patients. One of the challenges in treating endometriosis is the tunnel view that many surgeons and gynecologists have when approaching the disease. This narrow focus often results in the removal of only visible lesions or the ovaries and uterus, without addressing the underlying causes or potential pain pathways. A holistic approach to treating endometriosis is crucial for achieving optimal outcomes. This includes not only addressing the physical symptoms of the disease, but also the emotional and psychological impact it can have on patients. One of the key pain pathways in endometriosis is the inflammatory response that the disease causes in the organs and surrounding tissue. This inflammation leads to the formation of scar tissue and adhesions, which can compress and irritate pain fibers and nerves. The pain signals then travel to the brain, where they are interpreted and perceived by the patient. There are several options for treating the pain signals carried on nerves in endometriosis. Medications such as nonsteroidal anti-inflammatory drugs, NSAIDs, and opioids can be used to manage pain. However, these medications often have significant side effects and can become less effective over time. Counseling and other therapies can also be used to help patients manage the emotional and psychological impact of endometriosis. Cognitive behavioral therapy, for example, can help patients learn coping strategies and change negative thought patterns that can exacerbate pain. Mindfulness-based stress reduction techniques can also help patients reduce stress and improve their overall quality of life. Major surgery, such as bowel surgery, is often considered a last resort for treating endometriosis. However, it is important to understand the potential risks and benefits of surgery, as well as the potential for recurrence of symptoms after surgery. One of the risks of major surgery for endometriosis is the potential for damage to important organs, such as the bowel and bladder. This can lead to additional complications and a longer recovery time. Additionally, there is also a risk of increasing neuropathic pain, which is pain caused by damage to the nervous system. Recurrence of symptoms is also a concern after major surgery for endometriosis. In some cases, even after removing all visible lesions and scar tissue, endometrial tissue can still grow back and cause pain and other symptoms to return. Despite these risks, major surgery can be an effective treatment option for some patients with endometriosis, particularly those with severe or debilitating symptoms that have not responded to other treatments. It is important to have a thorough discussion with your healthcare provider about the potential risks and benefits of surgery, and to consider all options before making a decision. Take-home points. 1. A holistic approach to treating endometriosis is crucial for optimal outcomes, addressing the physical, emotional, and psychological aspects of the disease. 2. Major surgery such as bowel surgery is often considered a last resort for treating endometriosis, but it is important to understand the potential risks of surgery such as damage to important organs and increasing neuropathic pain. 3. Recurrence of symptoms is a concern after major surgery for endometriosis. 4. It is important to consider all options before making a decision about surgery and have a thorough discussion with your doctor. 5. Alternative therapies such as counseling, cognitive behavioral therapy and mindfulness-based stress reduction techniques can also be used to manage pain and improve overall quality of life for endometriosis patients.